Hi, Jim Jamison with Youngstown Orthopaedic Associates here today to talk with you about topics in joint replacement surgery. Today I'd like to talk to you about causes of hip pain. The actual source of hip pain really can be determined largely by what the patient tells us just in talking with them in the office. If a patient describes pain that's in the groin in the front, radiating into the thigh, that often really is hip joint pain. It could be from osteoarthritis or rheumatoid arthritis, particularly if range of motion is limited with a lot of pain. Could also be secondary to an injury to the labrum, which is a cartilage rim around the hip socket. Pain that's described as being out to the side, more commonly is something called trochanteric bursitis. It gives patients pain with lying on their side at night and may bother them sitting, particularly in a car with a bucket seat that wraps around and can bother them going up and down stairs. Pain that patients describe as being more in their backside or their buttock, just a little over to the side from the midline, just inside where your rear pocket is, that's more likely sacroiliac joint pain. That can give patients pain commonly getting up and down from a chair, with walking any distance, also with stairs. Pain that starts in the back, radiates around the side, can go down the leg and go down below the knee, more commonly originates from the lumbar spine and may be really evidence of a herniated disc or something called spinal stenosis that affects your nerve roots coming from your spine, which really isn't a hip problem. Treatment for all these issues always starts with conservative options: anti-inflammatories, physical therapy, stretching, Tylenol if you can't take anti-inflammatories. Sometimes we use cortisone injections. In some cases, such as with osteoarthritis or rheumatoid arthritis of the hip, surgery may be an option eventually. If you have questions about this topic or any others in orthopedics, please come see us at Youngstown Orthopaedic Associates. We'll be more than happy to talk with you. Thanks very much.